when we looked at our existing statute, we found it just was not adequate to cover the way that our healthcare providers were being asked to respond to this pandemic, in particular, the all hands on deck approach that was required. So we want to advance legislation, the Maryland Healthcare Heroes Protection Act, that will address the definitions of who is covered under those existing immunity protections, to recognize that COVID, unfortunately, is going to have a very long tail. Just as the senator said, it's changed everything. It has impacted every aspect of not just our personal lives, but also hospital operations for care, not just of those that are experiencing COVID, but also those that are in our hospitals for different reasons. And we want to ensure that that's taken into account in our existing liability immunity protections. And then finally, really looking at the length of time and it's going to take to get back to normal, if you will. How long will our supply chains be disrupted? When will our staffing start to stabilize? When will the last COVID patient actually be discharged from our hospitals? It will be long after the state declared public health emergency is over. And so we want to ensure that we have protections in place to account for this unique circumstance, but for future public health emergencies as well.